Hello, and welcome to this step-by-step guide to spaying a female dog, also known as ovariohysterectomy. This procedure removes the ovaries and uterus to prevent reproduction and reduce health risks like pyometra or mammary tumors. The first incision, we make a ventral midline skin incision starting 1-2 to finger widths caudal to the umbilicus, extending caudally toward the pubis. The length is typically 2 to 3 centimeters for an average adult dog, but we adjust based on size shorter for puppies, longer for deep-chested or pregnant dogs to ensure good access without excessive tension.
Step 2. Entering the abdomen. Lift the linea alba, the white midline tendon with forceps to tent it away from underlying organs. Make a small stab incision into the linea with the scalpel tip reversed, then extend it cranially and caudally using Mayo scissors. Keep the incision in the linea alba no longer than the skin cut to avoid herniation risks. This gives us entry into the peritoneal cavity. If needed, use blunt dissection with fingers or gauze to widen the opening gently. Step 3. Locating the reproductive tract. Insert a spay hook or your index finger along the abdominal wall to find a uterine horn. It's usually midway between the ovary and uterine body, dorsal to the bladder and ventral to the colon. Hook the horn and gently exteriorize it. Follow it cranially to the first ovary. The uterus feels firmer and paler than intestines. Step 4. Breaking the suspensory ligament. The ovaries attach cranially by the suspensory ligament. A firm band running from the ovary to the transversalis fascia near the last rib. To loosen or break it, first identify the ligament within the ovarian bursa. Hold the proper ligament with your right hand firmly, while with your left hand hold the suspensory ligament. Gentle caudal traction on the uterine horn while using your index, finger, or thumb to hook through the bursa and apply controlled. Downward pressure directly on the ligament. Pull caudally, not upward, to tear it gradually. Avoiding rupture of the underlying ovarian vessels or damage to nearby structures like the ureter, intestines, or spleen. This step allows us to fully exteriorize the ovary safely, reducing tension for ligation. If it's tough, you can make a small window in the broad ligament first for better access. Step 5. Ligating the first ovarian pedicle. With the ovary out, create a small window in the broad ligament, caudal to the pedicle using blunt dissection. Use the 3-clamp technique or just place sutures to clamp. Tie an encircling ligature, for example, modified Miller's or surgeon's knot, in the proximal crush groove using absorbable suture like PDS or Vicryl. 4 to 6 throws for security. cut between the middle and distal clamps, and check for bleeding before letting it retract. Then grasp the pedicle with forceps. Release the middle clamp slowly. Repeat for the second ovary, locating it via the uterine bifurcation.
Step 6. Removing the uterus. After both ovaries are ligated and excised, gently tear or bluntly dissect the broad ligament bilaterally down to the uterine body near the cervix. Ligate any large vessels if fatty or vascular. Retract the bladder caudally. Apply the 3-clamp technique to the uterine body, just cranial to the cervix. Cut between clamps. Remove the reproductive tract, about 95% of the uterus, and check the stump for hemorrhage before release.
Abdominal closure. Close the linear elbow with continuous sutures using absorbable material like PDS, taking 5 to 12 mm bites for strength without crushing tissue. Then, close the subcutaneous layer continuously to eliminate dead space and reduce seroma risk. Intradermal skin sutures. For the skin, use a subcuticular intradermal pattern with absorbable suture like PDS. Start at one end, passing the needle horizontally through the dermis on alternating sides to oppose edges evenly. No external knots needed for a cosmetic finish. Bury the ends or use tissue adhesive on top for protection. This avoids suture removal and minimizes irritation. Post-op, monitor for recovery, provide pain relief, and restrict activity. Thanks for watching. If you're a vet student or professional, consult full guidelines for variations. Stay safe.